This episode of the Black Doctors Podcast is brought to you by Empath IQ. Empath IQ provides reputation management and marketing tools to improve relationships between you and your patients. Their software platform encourages and curates positive reviews, enhancing your online reputation. Visit www.empathiq.io and mention the show to receive a special discount just for signing up. Check out the show notes for a link to their website.
The Black Doctors Podcast highlights the stories of minority professionals with the goal of inspiring others. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Hello and welcome back to Black Doctors Podcast. I'm Steven, your host today. So happy to be speaking with Dr. Ivrose Joseph. She is a Haitian-American, born and raised in Brooklyn, New York. She completed medical school at SUNY Downstate, where she stayed on for her residency in obstetrics and gynecology before continuing on to begin fellowship in urogynecology. Dr. Joseph, thank you so much for joining us.
Thank you so much for having me. I'm super excited.
Ça passe.
Ma boule.
Here we go. This interview's been in the works ever since I had Dr. Kiana Ward. She was my classmate. She was also your co-resident, and she was on our very first season. And bestie, yeah. She was on the very first season of the podcast, and shortly thereafter, she said, you need to get Ivrose on here to talk about interviews and urogynecology and all this. And so I am a chronic procrastinator. Little do you guys know. But nonetheless, here you are. So Dr. Joseph, let's talk about, the very beginning. Haitian-American, were you born here? Were you born in Haiti? What was your childhood like?
So I was born in Brooklyn, New York, at Kings County Hospital, which full circle is one of the hospitals I did my residency at. I'm the youngest of 7 children, Haitian parents, and first physician in my family. So a lot of shoes to fill, but by God's grace, I did it.
Yeah, born and raised in Brooklyn. So when did you decide to go into medicine?
I knew very early I wanted to go to medical school. When I was younger, like in 4th grade, I played around thinking I would want to be a writer. Actually, in 4th grade, I was fortunate enough to work with one of a prominent Haitian author, Ivrose Joseph. I don't know if you're familiar with her, but she was the cousin of one of my professors, my teachers. And so I thought I would want to be a writer and talk about, my childhood, my Haitian culture. But my mom got very sick at that time. And so my mind shifted, and I thought maybe I'd want to be a cardiologist because she had some, heart issues. And I said, I'll be a cardiologist so I can take care of my mom. So that's where medicine started to come into play. And I just stuck with it.
Yeah. So what kind of helped propel you along the way? Did you have a lot of resources and knowledge when you were heading into
Very
the
little.
field of medicine?
Very little. Like I said, I'm the first physician in my family, immediate and extended family. So you can imagine I had no one to really talk me through how to even apply to college, thinking about medical school was just, you can do it because you're smart. So I always had affirmations. And I think what my family couldn't do physically to support me in my journey, they did by supporting me in other ways. So I was encouraged very early. My family very supportive in that regard, but I really had to figure things out on my own. So I was fortunate to have really good teachers in high school, good guidance counselors that really helped me believe in myself and think that medicine was something that I could achieve.
So after high school, where'd you go to college?
I went to college at Smith College, one of the 7 sisters in Northampton, Massachusetts. And that in and of itself was a journey. So I'd never heard of Smith. I'd never visited Smith before I got there.
Oh, man.
Because coming from Brooklyn, New York, Flatbush, Brooklyn, my family's they don't know, driving me up to Northampton. That's not going to happen. But I didn't even know of Smith until my guidance counselor, my high school guidance counselor. I did very well in school. And so she was like, oh, I think you should apply to Smith. You would do great there. And I was like, okay, it's an all women's college. I started learning more about it and all the prominent women that have come from that school. And so I was just like, oh, that's okay. I'll apply. I applied and forgot it. Like, didn't even remember that I had applied there because I had my eyes set, on other schools. And then I was fortunate enough I got in. But once you get in, you get the financial, the cost of the school. And I was just like, whew, this is not going to happen because it's expensive. And then at that time, there was, in New York City public schools, you have like scholarships that you can apply for. And at that time, there was the Jerry Seinfield Family Foundation Scholarship from Jerry Seinfield himself. Each year in New York City public schools, he would choose a borough and to award full scholarships, full academic scholarships to those graduates. It just so happened that the year that I was graduating, he was selecting students from Brooklyn. So you had to apply, submit letters of recommendation, your transcript, essays. So I did that. Then you get through, that was the first round. So I think my year, 150 people applied. From 150 people, they interviewed 30. So I remember going and getting my suit to go on that interview. And from 150 applicants, 30 people got the interview. I was fortunate to be one of the 30. And from the 30, they awarded it to 15. Wow. So it was a full academic scholarship from Jerry Seinfeld. I'm very grateful. So I went to Smith without any loans, full tuition, 4 years paid. Thank God.
Are you a fan of the show? I
was always a fan of the show, but even more so afterwards because yes, you helped me out. You made Smith a possible, attainable a reality for me. So I was very grateful. And we had as Seinfeld scholars, as we were called, we had times where we could go to his events in New York City. I remember seeing him at a comedy concert at the Lincoln Center. Each year he would have like an annual banquet for his, scholars. So it was fun. Yep.
That is amazing. So you transitioned to this new school, new environment. The road to medicine isn't linear. There's always other things going on. So in the middle of this adjustment, you still had to stay focused on the end goal of becoming a physician.
Very much so. And Smith was, as you can imagine, Northampton, complete culture shock from where I grew up in Brooklyn. So I was in Brooklyn, Flatbush, Brooklyn. I was around people who looked like me. I went to school with people who looked like me. And I was in an environment where I was the minority. So I wasn't used to that. And I remember actually the morning after, because, imposter syndrome is very real. So I remember when I first got there and I was just like, I don't belong here. Like, what was I thinking? I should have just stayed in New York, stayed with my family. And then just thinking about the resources that Smith had, going to a school with that name, I said, I do deserve it. I've worked hard. I'm smart enough. So I really had to tell myself what other people have been telling me all along, that I was capable. Yeah. I had to start believing it because in Flatbush being one, I was able to shine because I was in a community where not many people had, unfortunately, the push to continue on with their education. So it was easy for me to shine. But in an environment like at Smith, I was the minority in a lot of ways. Yeah. And so I had to find my purpose, my motivation within myself.
So what did you major in?
So I actually majored in sociology and in pre-med. I did my pre-med courses, but I wasn't even planning on majoring in sociology. I took one sociology course and I just loved thinking that way, using the left side of my brain, reading the books. And so I took one class after another. And then by then I was like, oh, I have enough to do the major. And so I did sociology and pre-med.
After finishing college, you applied to medical school. You ultimately were accepted to, I'm sure, multiple schools, one of which being SUNY Downstate.
Yes.
So how important was it for you to return home, essentially, for medical school?
It was very important to me. So when I went to medical school, I knew that I wanted to take care of patients who looked like me. I wanted to be in an environment where I could really uplift my community. And so I was fortunate to have acceptances at other places, but, thinking about SUNY Downstate in Kings County, it's such a wonderful institution in terms of the patients that I would have the privilege to serve. And so when I thought about that, I thought about Kings County, where I was born. I said, okay, I think this would be a good fit for me. My family's there, so I'll have the support for medical school, because I knew it would be challenging. And so I said, yep, I'll do medical school at SUNY Downstate. My family, of course, were excited to have me back. So that's what made me choose SUNY Downstate.
And at that point, did you know that you were headed towards a career in obstetrics and gynecologic surgery?
I knew I had wanted to do urogynecology. So in college, I did do a mission trip to the Dominican Republic, and I worked with not only the Dominican patients, but also the Haitian refugees to the Dominican Republic at a public hospital, one of their public hospitals in San Francisco de Macorís in the Dominican Republic. And there I had the opportunity to work with OBGYNs and urogynecologists. And I just thought, oh, that's, what they're doing is very interesting. And then I had thought I wanted to do a lot of fistula work, mission work, and take care of women with fistulas. And so that's what made me start thinking maybe I would want to do urogynecology. I wasn't sure if I would do it through obstetrics and gynecology, but I knew I wanted that specialty was of interest to me.
Yeah. So coming out of medical school, you applied to residencies, and you ended up matching at SUNY Downstate.
Yes.
So that planned, or did it just happen, or what?
So it became planned. So initially I thought I wanted to go away. So I said, okay, I already did medical school at SUNY Downstate. I'll go away for a residency. And then I interviewed at different places, but then I said, okay, I really want to take care of the women in Flatbush, in East Flatbush. And so I said, okay, last minute, I changed my rank list right before it was due.
Wow.
And then I moved downstate up. And so I stayed on. Yeah. And it worked out because I made a lot of, great friends. And I loved taking care of that community. So.
Yeah, even with Dr. Ward as your senior resident?
She's my fave, one of my faves, okay? Wardy is a great physician.
So during residency, did you get a chance to rotate through your gynecologic service?
Yes. So even as a medical student, so I knew I wanted to do urogynecology. So as a fourth year medical student, I did an elective in urogynecology. And then as a third year resident, I had the opportunity to do an OA elective at Brown. They have one of the big divisions in the field. And so, again, solidifying that this is really what I wanted to do.
Yeah, and I think it's so important, as I've been able to speak with other people in different specialties and subspecialties on this podcast, that there's so many incredible subspecialties in medicine. So can you talk for a little bit about this field of urogynecology?
Yeah. So I can talk about it at length. So basically urogynecology, or the other name for it is female pelvic medicine and reconstructive surgery. What it is a subspecialty in OBGYN, or you can do it through urology, where you take care of female patients or patients with pelvic floor disorders. And that really encompasses, many common but infrequently discussed conditions, which significantly impact women's quality of life. And these complex disorders, such as urinary and bowel incontinence, pelvic organ prolapse, childbirth injury, genital fistulas, recurrent urinary tract infection, bladder pain, and sexual dysfunction. So these are many conditions, many disorders that you, as the subspecialist, you're able to take care of those patients. And a lot of it is managing and taking care of patients and improving their quality of life. I always say, when I see a patient with prolapse, I'm like, this is not going to kill you. This is more about your quality of life. And because my patient population tends to be a lot older, I see the importance of making people comfortable in their last few years or several years of life. And so, the stigma around it is what really motivates me to talk about it, because a lot of women with incontinence, with prolapse, they feel ashamed. They don't want to talk about it. And I'll see patients with complete precedentia, and I'm like, I know you've had this for a long time. They said, years,
complete
doctor.
What?
I've had it for years. Would you say?
Complete what?
Complete precedentia, which is where where they have complete prolapse. So it could be complete eversion, or the uterus is coming out completely out of their body. So it takes years for that to happen. And so, these patients suffer in silence. They don't want to bring it up to their providers. So I get the opportunity to take care of them.
And as we were hanging out a couple weeks ago, and you really kind of blew my mind explaining everything that went into the subspecialty. When it comes to awareness and discussion, obviously there's a lot of healthcare disparities, and obviously disproportionately affects minority communities. What would you say to those patients, those families, about getting these conditions checked out and seeking help?
I would say that we have treatments available, especially for prolapse and bladder dysfunction. So incontinence, urinary incontinence, fecal incontinence, and pelvic organ prolapse. I tell patients all the time that we, in this subspecialty, that we can take care of your issues. We can make you, as dry as possible. We can definitely fix your prolapse. But patients, if they don't know about us, or they don't know that we can take care of those conditions, won't mention it. So I always feel like the burden is on the providers, whether you're a family medicine, internal medicine, primary care physician, that you bring up those issues, OBGYN, you bring up certain, those issues with your patients and have that conversation, start the conversation. But many of those things that I mentioned are fixable, and it affects their patient's quality of life so much that it breaks my heart when I see a patient that they're telling me they don't go to church, they don't go out anymore, they're not hanging out with their friends because they cannot make it to the bathroom in time, and so they're soaking all up their clothes, or they always have to look for bathrooms wherever they go, because that is at the forefront of their minds. And so I'm like, I can take care of that. Just come to me, and I'll take care of you.
Yeah. So obviously, I don't really work primary care and do anesthesia, but so I work with your colleagues in the OR, but for those physicians that are seeing these patients, you mentioned family medicine, internal medicine, probably some ER physicians and obstetricians, kind of the generalists. What would you say to them in terms of evaluating and triaging patients so that they get to see you and your colleagues?
So, simple questions. You can ask them, do you have any problem, any trouble holding your urine, any trouble holding your stool? That will get the patients started or thinking about, hey, maybe I do leak urine. Do you feel like a bulge, something coming outside of your vagina? Very, 3 quick questions that you can ask patients. And then if they do say yes, okay, I'll refer you to your GYN. And oftentimes the gynecologist, they'll refer to, the urogynecologist.
Gotcha.
But especially for the family medicine, internal medicine colleagues, 3 simple questions, and you can refer to GYN or even urogynecology.
And when it comes to urogynecologists, because you guys do some pretty specialized procedures, what talk about those? Oh,
there's so many. So, like I said, one of the conditions or disorders that we treat is pelvic organ prolapse. And there's such a wide variety in terms of how we can treat this disorder. There are non-surgical options with, pessary, pelvic floor exercises. I'm working with a pelvic floor therapist. But the other side of it is surgical management. Sometimes, your prolapse is advanced stage, because we stage the prolapse from 1 to 4, 4 being the most severe. That if it's really severe or it's impacting your quality of life, or, any reason at all, basically if it's elective surgery, so if the patient is bothered significantly by it, we can definitely consider, surgical treatment. So we do vaginal surgery, robotic, laparoscopic assisted surgery, or open, but usually it's a minimally invasive surgery. So usually vaginal or robotic laparoscopic surgeries. And for severe prolapse, there's a variety. If a patient, it depends on the medical condition. So if the patient is a poor surgical candidate, then we'll try to do the least amount of surgery. So that's usually vaginal. Whether that's just a vaginal hysterectomy or another procedure that we often do is a colpocliosis, where we close off the vagina for patients who don't want to continue with sexual function. But if patients are interested in maintaining their sexual function, then we will oftentimes do an abdominal procedure with a sacrocolpopexy. That's where we use mesh abdominally to fix the prolapse.
And then you guys do these interstim devices?
Yes, we do. So interstim, it's called sacral neuromodulation. And so we can do that procedure for patients with urinary or bowel incontinence. And so if patients, we have an algorithm, patients will try lifestyle modifications, medications. And if medications are not helpful, then we can offer them as Botox injections inside the bladder for their urinary incontinence. And if patients don't want Botox, or they'd rather go with the neuromodulation than interstim, there are two main companies, Medtronic and Axonics, that are available for patients at this time.
It's like a remote control for your sphincters.
But it's like a pacemaker for your bladder and bowel. So we, you'll have like a little battery that's inserted on your buttock, and it's interesting.
Pretty incredible. Yeah.
Incredible, yes.
Again, for most med students out there and pre-med, you may have no idea that this incredible field even exists. And then these specialized procedures that you get to do in this field are amazing.
Yeah, it's very specialized. It's very, surgically, it's a surgical subspecialty. So I always tell students who are thinking, I may want to do surgery, but I don't want to necessarily do general surgery, consider OBGYN. And then in OBGYN, you have, surgical subspecialties such as urogynecology, GYN oncology, or minimally invasive GYN surgery as well.
Yeah, that is fantastic. Dr. Joseph, in addition to everything that you've done clinically, and you're in your second year out of 3 for the fellowship, correct?
Yes. Mm-hmm.
When I first spoke with Dr. Ward, she spoke highly of your skills when it comes to interviews. I know we're kind of in the middle of interview season for medical students. When did you first kind of realize that you had a knack for interviews?
I think if I go back and think, I would say when I did that interview for the Seinfield scholarship, I realized, I realized that I was really good at answering questions. Like I knew what, the interviewers were looking for. And so once I realized that, it really didn't occur to me that I was like really good until I started coaching people. So I started coaching my co-residents who were looking for jobs or applying to fellowships, medical students who were applying to residencies. And I would just do mock interviews and ask them questions and see how they would answer, and then help them frame their answers, in a way that I think program directors, employers that would work in their favor.
What are some of the top mistakes that you see folks start to make when you're working with them for interviews?
I think people don't sell themselves enough. It's a skill because you have to do it in a way that you're not coming off arrogant. But you also don't want to downplay all of your accomplishments. And so it's knowing the right way to put them in. So it's, you keep the conversation going. But one thing that I notice is that people underestimate what they've accomplished and they don't sell themselves enough. And being bold in the interview in terms of, if you really want this job, you want this position, say that, and why you would be you would be good at this position, why you would fit into this residency program, this fellowship program. Be yourself, because as someone who now interviews with the fellowship, I can tell when someone is putting on a show, when they're not being themselves. So it's a balance, but I think I can help people get that balance.
So, Dr. Joseph, why should I hire you to my boutique urogynecologic practice?
Why should you hire me? Well, because I care for my patients. First and foremost, I really want to take care of my patients, improve their quality of life. But also, I'm surgically inclined to take care of my patients. I have the skills. I did a fellowship, seen a lot of cases, done a lot of surgeries that I think that I'll be able to take care of women and take care of them safely. I'd be good.
Very good. All right. Hired. And in addition to medical students, residents, when it comes to even looking into jobs, like what are some things or some ways that applicants to jobs can really excel on their interviews?
I would say, find out what you would add or bring to that job specifically. So I know for me, during my interview for fellowship and even residency, I was emotionally tied to Kings County SUNY Downstate. I knew I wanted to be in that environment. I wanted to take care of the patients. And so I think when you're looking for a job, whatever field, knowing why is that position so important to you? What would you add? What would you bring? If all physicians, the playing field is equal at that point. We've all done the same training. We've had the same amount of training. We've done the fellowship. We've done, the research. So what are you going to do that's different? And I also think the personality is important. Sometimes people they don't come across well to employees or to employers. And so I think if you know that you are someone that's shy, you may be quiet, reserved in an interview. So that can come off as being standoffish to an employer. And so you may want to have a coach, and you may want to do mock interviews so that you're forced to talk about yourself, forced to talk about your plans, your career goals, so that when you're interviewing, it's not the first time that you're answering those questions. Because if it is, then, if people can see that, and it may not work in your favor.
It's very helpful. I like what you said, that the playing field is now equal. Because I know as students and as minority students, we're always kind of fighting this uphill battle, in part having the imposter syndrome. Am I good enough? Do they want me? And, towards the end, you start to realize your worth. And like you said so plainly, the playing field's now equal.
Right. Because you went to medical school, your scores are what they are. If they offered you an interview, that's why I always say, I just need the interview. Because once I have the interview, I'm going to sell myself that you will see Ivrose, that you will see me, and that you would want me. And I remember that vividly because, I went on the interview trail for urogynecology for fellowship. There are not a lot of positions, not a lot of spots. A lot of people are coming from renowned, programs with well-known faculty. And so I felt like, I was at a disadvantage because here I am doing this. But I said, you know what? They offered me an interview. So on the day of the interview, I'm here. So I'm here. That means we're equal. And all I have to do is sell myself and go in the interview and just, go for it. I want this position. I want to be a urogynecologist. And I didn't leave the room until I felt my interviewer knew what I wanted to do and how I would do it at their program. And so for residency, I would tell applicants to do the same, making sure that before they leave, that the interviewer knows that this person really wants to be here. This person really wants to do this specialty. Let's give them a chance.
What are some questions that, applicants to residency should ask their programs?
I would say there are different categories of questions. So I think you want to, and I'll give broad categories. So you definitely want to ask about how will your learning be structured? So do they have formal didactics sessions? Who's doing the didactics? So you want to know about your learning. Is it prioritized? Is it service? Is the program service over learning, where you'll be doing a lot of scut work and not really have faculty members dedicated to your teaching? You want to know that, because at the end of the day, especially if you're a resident, trying to, working or applying to become a resident, you want to learn. You want to make sure that your attending physicians, they're doing what they're supposed to do, being at an academic facility to teach you. The other thing is you also want to learn what does the department itself value, the values of the department, whether they value diversity, inclusion, whether they value wellness. That's such a big, important component that physicians, we don't talk about enough. Wellness and to making sure that we are healthy and taking care of ourselves as we take care of patients. And you also want to know, hey, looking at this department, anyone who looks like me here, any residents, any faculty member, in this day and age, you do want to know because you want to be comfortable. That's one of the things that drew me to my program at Emory. Seeing my division director being a woman of color. And I said, I could see myself. I see someone who looks like me doing this, so I could do it too. And so that's not always, something that you need, but I knew I needed that. So it's reconciling your values, what you're looking for in a program, and asking targeted questions, doing residency interviews at these programs to see if they will align with your values.
Very good information. Lastly, this is a question that I've gotten a couple times, and you're doing some interviews and involved. So in this world of virtual interviews, it's been around for a good 2 years now. What are some common mistakes that you're still seeing in people that are doing virtual interviews?
Thinking that the mute button is on when it's not.
Oh yeah, I got caught there at a fellowship interview because I had a tennis match on. I knew it was on mute. I was pretty sure. And then the program director was like, "Oh, tennis fan."
Yes, you'll be surprised. You want to. I always say you stay professional all the way through until you close the screen. You maintain your professionalism because you don't want to be caught, like doing something crazy on camera or saying something ridiculous. And so a lot of people, I think they think that they hit the mute button or the video of the camera, turned off the camera and it's still going. And so, you hear things I shouldn't have heard.
That's yeah. What about, I saw this on Twitter. I don't know if it's a true story or not. Somebody said they were interviewing and their virtual interviewer had them stand up to make sure that they were like wearing a full suit. What would you do, or what would you say to do if somebody told you to do that in an interview for residency, right?
I would do it because, I would. So my mindset is if I'm doing an interview, I actually do wear like a full suit. Even when I'm like, if I'm interviewing as a fellow, like I'm interviewing potential candidates, I'm dressed. I'm not like slacking. I don't have pajamas on at the bottom. And so I wouldn't be opposed if someone wanted me to stand up and do it because I know I'll be dressed to do it. And so I think putting on the full suit, even though you're only going into your living room to do it, I think once you put on that character, you put on the suit, for some reason, for me, it gives me the confidence. I take it more seriously because I know this is an actual interview. I haven't done that. I don't think that's necessary. But I think if someone would have asked me to do an interview, I think I would be dressed fully, so I wouldn't mind doing it.
That's good. All right. You're a pro at this interview thing. And I know you're obviously very busy with fellowship and you are amenable to helping people when you can, your co-residents, medical students, et cetera, with interviews. I don't know. Do you have any formal program out there to help other students?
I don't yet. Usually it's people who put people in contact with me, and then I'll set up a time to interview people, to do mock interviews. So I don't have like, a website or, something for people to reach out to me directly. But I'm available. I can give you my email, which you have my personal email, but I'll give you like my professional email that people can reach out to me. And
then any social media sites or LinkedIn that you're
I do
active
have my
on,
LinkedIn, so people could reach out to me through LinkedIn, which I use it pretty, commonly. So I'd be okay with people reaching out to me there. I'm on social media, but again, private, personal pages, which I'm not opposed. I'm open book, so I don't mind if anyone finds me on social media, Instagram, Facebook, and reach out to me that way. I'm just happy to help, and I usually make time. I am pretty busy as a fellow, but I make time for interviews because I think that's important.
Yes, that is incredible that you do this, and you're definitely helping to increase diversity in these respective health fields. Dr. Joseph, thank you so much. You've added so much value just talking to you, the tips that you provided about interviewing and all the information you shared about the field of urogynecology. Thank you so much for joining us on the podcast and for being here today, because representation matters.
Thank you so much for having me.
The Black Doctors Podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. Tune in next week for another episode of the Black Doctors Podcast with Dr. Stephen Bradley, your friendly neighborhood anesthesiologist.